Hi everyone, I'm Emma. Welcome to the Up3D Digital Dentistry Academy. I will be the host of the first session. Today, digital technology is changing the dental field. For example, traditional impressions are slowly disappearing and more clinics and hospitals are choosing digital intraoral scanners. So when using the iOS in the clinic, how can we get each scan quickly and efficiently? In this session, I will show you some up 610 scanning tips that help you capture the data you need fast. Let's do it. Before the start, we need to get the environment and equipment ready and talk with the patient. First, check that blue isolation film is neatly placed on the area we might touch. All dental instruments are already sterilized and ready to use. Then, we can explain to the patient that we will use an intraoral scanner to quickly take images. To ensure there are no interfering bubbles in the scan data, we need to use a triple syringe to blow away the saliva. Okay, let's scan the upper jaw first. For faster and better scans, we need a support point to keep the scanner steady. Okay, let's start scan. Start on the chewing surface of the back teeth. At the front teeth, move in a gentle S shape. Be careful not to touch the molar pads. Scan carefully around the restoration. Move from the biting surface down to the cheek side in two parts, left and right. Stop around the central incisors. Okay, it's done. I usually don't touch the mouse on screen directly. We can just double-click the button, move the blue circle to the icon, and hit it. Let's have a check. Okay, let's again stand here. Be careful to the interproximal places. It's done. Next step. Double-click, move to the right, hit it. I had 10 and 34 frames and took 1 minute. Now let's scan the lower jaw. Move from the chewing surface, S shape at front teeth. Scan carefully around the restoration. Don't forget our out-front support point. Alright. Scan left and right separately. Let's have a look. Okay. Let's end the scan here. We can rotate the scanner head slightly. It's done. Let's go to the next step. Next, we scan the bite. To obtain accurate occlusal data, we need a correct occlusal position. How do we do this? First, ask the patient to open their mouth, and then move the scanner from the center towards one of the buccal sides, from back to front. Tell the patient, please gently clench and swallow. The scanner needs to go deep enough. Move from the 7th molar to the premolars. Okay, it's done. Moving from back to front. Please gently clench and swallow. Next, starting with the 7th molar, scanning the buccal sign to the premolars. Okay, I had 10 and 38 frames and took 1 minute and 56 seconds. If the scan goes too far forward, big gaps may appear in the back teeth bite, which means the bite is incorrect. Now let's just wait for the result. If the waiting time is too long, we can talk with the patient to relax them. We can talk the principle of the scanner. It's like a tiny camera for your mouth. It captures loads of quick shots. There are no messy impressions anymore, just fast and easy. Here's a friendly reminder. Please have the patient stay here for a moment after the data is checked. Well, let's review the scanning we learning today. The first one is pay attention to the area around the restoration. We need to check if the restoration markings are clear, make sure there are no cavities, and confirm that the contact surfaces with the neighboring teeth look good. The second one is we need a support point to keep the scanner steady. The third one is be careful not to touch the molar pads. I hope today's scan tips were helpful. For more tips on scanning and using the Opsys 10, please click the link to our official website below. Thanks for watching and see you next time at Ops 3D Digital Dentistry Academy Data Standing.